I will be speaking in a moment, but by now I'm going to introduce our next two speakers. First of all, Councilwoman Glendalise Colon. Councilwoman Colon is working tirelessly on this issue in Central Falls. Central Falls has had major leadership on this issue. It is my pleasure to bring Councilwoman Colon from Central Falls to the podium.
Strong support of legislation to give health care coverage to all Rhode Island children, regardless of legal status. In Central Falls, our city is comprised of so many beautiful, hardworking families from many backgrounds, cultures, and countries from all over the world. Many are undocumented, leading to families unable to access important benefits that were lifelines to Rhode Islanders during this pandemic. But a lack of health care coverage for these children may be the most devastating. During this COVID pandemic, our city was the hardest hit community throughout the state, experiencing the highest rates of infections and hospitalizations. Our immigrant families, particularly those who are undocumented, suffered greatly. Paired with the devastating health risks we see from having the highest child-led poisoning rate in the state, this issue of health coverage is an urgent one. No child deserves to live with health risks or conditions simply because their families cannot afford health care. As a state, we should protect the lives of all of our children. Families, including those who are low income and undocumented, having access to life-saving health care coverage is an essential part of that. By giving all kids access to health care coverage, to access routine care, we are curbing a much costlier consequence to blocking their coverage altogether. Health insurance, like Right Care, increases the likelihood that children will receive needed preventative services and reduce emergency room costs down the line. It is far more cost-effective to provide access to primary preventative care to undocumented children than paying the far higher cost when a health condition that could have been prevented or treated early escalates to an ER visit that our state pays the bill for. Before our mayor, Maria Rivera, became the mayor of Central Falls, she worked at the Rhode Island Department of Human Services as a senior eligibility technician to help families overcome many hurdles. She witnessed firsthand how families can be impacted by sudden job loss, domestic violence, teen pregnancies, disabilities, and so many other life challenges. Without a doubt, one of the greatest challenges witnessed was our undocumented families living without health care coverage. This is a devastating and vulnerable reality currently experienced by too many children in our state, through no fault of their own. I'd like to thank Councilwoman